Hi, I'm Dr. Owens. Today I'm going to show you how to treat carpal tunnel naturally without drugs and surgery. The carpal tunnel, just to give you a brief description of what it is a spot in the body in which a nerve runs between the wrist bones or the carpals and a ligament which runs over the top. This gets irritated through repetitive motions of maybe mouse work, little intricate, detailed, fine movements of the hand over and over and over again. This nerve and the tissues around it get irritated. To treat it naturally, it's best done by a chiropractor. And you need a chiropractor with some special qualifications. You need a chiropractor, first off, that knows and has experience in adjusting what we call the extremities, which just means the parts of the body other than the spine. Example, you want to have one that can adjust the wrist, the elbow, the shoulder, definitely the neck, which is not an extremity and most chiropractors should do, but the extremities would be the arm. All of the joints of the arm would need to be included. Alright, so when we first start to address someone with carpal tunnel syndrome, this is a person that in this hand has a problem. So we check, the first thing we want to check would be the alignment of the carpals and the flexibility of the carpals, especially as they relate to the rest of the arm. And you can see here, I don't know if the camera can pick this up, but he's got good movement in this area of his carpals. When we look to here, and right here it feels a little restricted, so I would want to adjust that. We would do a little adjustment where you totally relax your arm, and that would be an adjustment of the carpal region. We just work our way through all 8 bones of the carpals, making sure they're in the right position and have the right flexibility. The elbow can also be involved, and we check the elbow by feeling, if we feel restriction in the joint, either one of the elbow joints there, and if we feel some restrictions, we do a little light thrust to the joint. If it's this one, it can sometimes look like that. So that would be adjustment of the elbow, because the median nerve traverses from the neck all the way down. Okay? Shoulder joint can be out as well. We'll move over behind the patient, making sure the shoulder is properly in the socket, and we deliver a little thrust into the shoulder there to get it in the proper alignment. The second thing that we want to give you a close-up view of is just the tool that I use. This is just a tool that can be used to treat areas, help muscles, ligaments, tendons, remove the thing called scar tissue. And scar tissue makes it weaker, less stretchy, and more painful. When we use this tool to go over an area, it really gets rid of that scar tissue and helps the area heal and become more flexible and pain-free. And that's how I treat carpal tunnel syndrome naturally without drugs or surgery.